Hello and welcome to our first ever Power Your Health Q&A series. My name is Michelle Vilsack. I'm the Marketing and Membership Coordinator for the National Health Association who's hosting this conference. And we're so excited that you're here. If you're excited to be here, go ahead and jump in the chat and tell us where you're listening in from. Give us a little hello and let us know how you're doing. We are so excited to be here because this is our very first ever Power Your Health Q&A series. So we've got tons of special guests lined up for you once a month, every Tuesday, fourth Tuesday at 4 p.m. Pacific time. We'll be here interviewing a special guest, and we're super excited for our first one. Dr. Goldhamer is going to come and answer your questions about fasting and various other things. We've seen a huge community has already come together, and a lot of people have registered for this Power Your Health Q&A. We've got a ton of questions to answer for you. Hi, Marcia. Hi, Patty. Come on in, Brian. Becky, how are you doing? It's so nice to see all of you guys. So we're just going to dive right into this. I'm going to introduce Mark Huberman, who is the president of the National Health Association, and he's going to answer your questions that you've already submitted for Dr. Goldhamer. If there's any extra time, I don't think there's gonna be any extra time to put in extra questions. We've got so much already, so much ready for you guys. And so let's just dive in. Without further ado, here is Mark.
Hi, Michelle, and hi, all of you out there who've tuned into this inaugural edition of Power Your Health Q&A. We're really excited in the NHA to be able to offer these free monthly Q&As with some of the real stars of the whole 100% whole plant food movement. There's nobody better that we could be starting off this inaugural Power Your Health Q&A, but with someone whose history is synonymous with the NHA. He's been a board member of the National Health Association for, I think we were talking off the air, probably for 30 years. He's a life member of our organization. And he probably single-handedly has done more to advance the science and art and practice of water fasting than Dr. Alan Goldhamer of the True North Health Center. So it's a real privilege to welcome to this first Power Your Health Q&A, the Dr. Alan Goldhamer of the True North Health Center. Dr. Goldhamer, great to have you here.
Nice to be here, Mark.
So we do have a lot of questions for you here, and I kind of went through them, and I've tried to there's a lot of duplications, and we had a lot of people that would ask very specific questions about their own health, and I've tried to kind of group them and so that they're not so specific that you'd have to see a person individually. But the first one, not surprising in this world, is COVID. And people want to know, someone wrote in and said, I was diagnosed with the Delta variety of COVID. I was very sick, lost my sense of taste and smell, also had a kidney infection since July and had antibiotics. My question is, can I get better can I get better without the vaccine? Will my taste and smell ever return? Again, COVID, fasting, COVID, and vaccines.
Wow, well, that covers a lot of area.
Covers a lot of ground.
One thing that we know is that we're seeing a lot of people that had COVID, they recovered from COVID in terms of, they're no longer infective, but they have residual symptoms from their COVID experience. They have fatigue, they have loss of smell or taste that's persisted beyond the couple of weeks that are, most common. And we have fasted some of those individuals, and I'm happy to say that many of them have responded very dramatically in terms of restoring smell and taste and improving energy. So it does seem that fasting has an application in long COVID. We're also seeing increasing numbers of people that had vaccination for COVID, but then developed problems associated with that vaccination. And some of those problems are similar to the problems people get when they contract COVID, which is persistent fatigue and problems with taste and smell. And those patients also seem to be responding, as a general overview, to the typical approach we take with diet and fasting. We've also seen patients that have active COVID, some of which have fasted, some of which is just ate healthfully, and so far, most of them have done very well and had relatively minor symptoms. We don't have enough experience yet to know whether fasting has application in acute COVID or not. There are concerns about hydration status and other things, that might make you cautious about entering into a water fast during an active acute infection. But so far the patients that we've seen that have undergone that process seems to have done well. So we're still trying to learn more about this. And as you mentioned, there's different versions of this virus too, and they may respond differently. So I think we have to look back. We'll have to look back a year or two from now, and before we can come to firm conclusions about what the very best strategies might be at both preventing and treating this condition.
So one of the questions also is, and again, this is one that arose early on when COVID was first hitting within our movement, is COVID just another form of the flu? And should we
I think
the same way as any other flu?
I think it's a little different than the flu, and there's some more significant consequences, in part because it's what's considered a novel virus. It's a new virus, and so you don't have a lot of previous herd exposure and immunity that is developed. So even though only a small percentage of people have very severe symptoms, when a large number of people get an illness and a small percentage of that large number are very ill, you can fill up a lot of hospital beds and have a lot of sick and occasionally dying people as well. So I don't think it's exactly the same kind of thing you see when seasonal flu goes through, although it is interesting that this year there's very little influenza, maybe in part because of kids being out of school, which are a common vector, maybe in part because of increased hygiene in terms of hand washing and the rest. But so this year we haven't had the 10 to 30,000 people that normally dying from influenza, but we've had a significantly higher percentage of people that have been dying as a consequence of COVID. But one thing I want to make really clear, and I think it would be generally agreed, is that the things that make people vulnerable to dying from COVID are the same things that make people vulnerable for dying from heart disease and diabetes and cancer and autoimmune disease. The same risk factors include things like obesity and having underlying health concerns. And so one thing we should, I think, be doing as a society is saying, oh dear, we're now dealing with this novel virus. Why don't we do the things necessary to get ourselves healthy so that if we do get exposed, which is, likely eventually, we'll develop robust immunity and be, recover and not have residual symptoms and do fine. And so one of the things we can do to do that is to take a serious look at what it means to actually get healthy, to lose the extra weight, to develop a healthy whole plant food SOS-free diet, to ensure that we're getting sleep, to learn to manage our stress more effectively. A lot of people are under tremendous stress as a consequence of the social changes that are going on in relation to this pandemic right now. One thing is the social isolation that people are experiencing. If you have a prisoner, one of the worst punishments you can do to a prisoner is to put them in isolation. They find it very stressful. And of course, we've kind of done that in a sense to a whole society. And so the stress hormones associated with isolation, associated with the constant news feeds and all the sensationalism that's done around these and other issues, probably has a fairly powerful immunosuppressive effect on people as well. So maybe we shouldn't necessarily listen to the news every day. Maybe we can just do it occasionally and still be fully informed citizens. Maybe we can dissipate our attention with regular exercise. Maybe we can, to the degree possible, interact effectively with people that are health promoting and supporting. And take this time as an advantage to focus on our diet and lifestyle issues so we lose the extra weight rather than gaining the weight, stop drinking alcohol rather than increasing our alcohol intake, and develop effective strategies to get healthy enough so that in addition to your social distancing and hand washing and all the other things that you're advised to do, I wish there was more advice about actually getting healthy, because I think that's going to do more than anything in the long run at helping people become more resilient to these challenges that we're facing.
Just a couple other COVID-related questions, and we'll move on to other areas. And this relates to True North protocols. One of the viewers asks, do you have to have a vaccine before you come to True North? Mm-hmm. And what protocols when they arrive at True North are COVID related?
Well, of course, requiring vaccination might protect an individual who got the vaccination from having a serious response. That's the claim that's made around vaccination, but it wouldn't keep you from getting COVID. and it wouldn't keep you from spreading COVID. I think that's generally well accepted, that people, whether they're vaccinated or not, can still contract, manifest the symptoms of COVID, and they can still spread the virons associated with COVID. So that's why they'll tell you that whether you're vaccinated or not, you still would need to practice social distancing, wear masks, do your testing, et cetera, regardless of whether you individually are vaccinated or you're not vaccinated.
So do you do that at
True
North?
At True North Health recognizes the fact that we want to encourage social distancing as appropriate. And one of the things we've done to help with that is we've gone to live streaming all of our classes every day, twice a day, so that people can participate, whether they're social isolating or not, that people wear appropriate protective gear in public spaces. So we wear masks in public spaces, and we have outdoor dining and activities so people can reduce their risk of exposure to patients. And if we do have somebody that's symptomatic, we will isolate them. And so we have set aside provisions to isolate anybody that has any symptoms until we can administer rapid antigen testing to verify whether or not the individual is positive for COVID. If they are COVID, they'll remain in isolation for 10 days until they're no longer infective, and we'll provide the same kind of supportive care that we always provide, which is a healthy diet or fasting as appropriate, and try to make the experience as comfortable as possible and hope they develop robust immunity with minimal secondary side effects.
Is there a light on the horizon that you think that these changes to your operations will come to an end sometime soon?
Well, no, I think that it'll be a while, because I think that when you have a large population of people that are inevitably going to get exposed to this, and the vulnerable people are going to get sick, and the most vulnerable people are going to have acute symptomology, I think it's going to be a while before the general population develops robust immunity, and it may become less of a pandemic type response. But you're likely to see, like what you do most years with things like influenza and other things that kind of make their way through society, and the most vulnerable people sometimes have very unfortunate reactions to it. But overall, the combination of interventions that are being done and people being exposed and developing natural immunity should reduce the magnitude of the population's exposure. At least that's the theory today. Now, what you don't know is, remember, viruses mutate, viruses change. In general, they tend to become more infective and less deadly. A virus that kills everybody it gets to doesn't spread very well. It has a disadvantage. So there's an advantage to viruses that are easily spread, but then become less and less spread. We're hoping that's, in fact, what will be the case with this particular.
I think you'll appreciate this observation. My wife Wanda and I were at a fundraiser for our local food bank, and there was a plant-based physician, a very, very good friend of ours, who's a nephrologist, kidney doctor, and she was speaking to the crowd, and it was all the meals were SOS free, and she did the meals. It was great, and we supported the event. She made the observation that in the COVID wards, where she's at every day, making the rounds, they're all obese. There's not maybe a rare cancer patient that she'll see. Well, everyone in the COVID that is hospitalized with serious COVID suffers obesity.
In fairness, though, Mark, 2/3 of people in society are overweight or obese. A significant percentage have diabetes, hypertension, autoimmune disease, and cancer. It's hard to find healthy people. So it's not surprising that the vast majority of people that are having really bad reactions to this virus and ending up with pneumonia and secondary issues would be overweight and ill. I mean, we know those risk factors do make people more vulnerable to dying, not just to COVID, but to heart disease and cancer. Let's be clear, as bad as COVID's been, every year, hundreds of thousands of people are dying from heart disease, from cancer, and many of them are vulnerable from the same risk factors that are making people vulnerable to having bad reactions to this particular virus. And this isn't the last virus we're going to see. I mean, this is an ongoing challenge that you have. It's been going on for a long time. It'll likely keep going on for a long time. And so even if you successfully navigate this particular virus, whatever methods, are used, it's not the end of it. It's the beginning, in the sense that we have to continue to be diligent about getting healthy individually, if individually we want to be able to adapt to these challenges that are inevitably going to continue.
Very good. Well, Dr. Goldhamer, you're, again, if there's anything you are synonymous for at the True North Health Center, it's your expertise, the world's headquarters for water fasting and the benefits of water fasting, water-only fasting. And someone asked a question, though, that I've heard you say in other interviews, that over the long term, intermittent fasting, time-restricted eating, may be as effective as water-only fasting. And wondering, do you still stand by that? Is it a good substitute?
You've never heard me say that intermittent fasting is as effective as water-only fasting. What you've heard
somebody heard it.
Is that the accumulation of intermittent fasting. When we talk about intermittent fasting, we're talking about time-restricted eating, limiting your feeding window to, say, 8 hours a day, and fasting 16 hours a day. So that would mean essentially you don't eat 3 to 4 hours before you go to bed at night. And then maybe you delay breakfast a little bit so you can get some exercise in the morning or something. So you have a period of anywhere between 12 and 16 hours of fasting each and every day. And based on the work that Walter Longo and others are doing, it seems that even that little bit of fasting behavior, cumulatively, day after day, after week, after month, may add up to significant biological changes. Now, it is different than medically supervised water-only fasting, where you go for a longer period of time. And we can talk about that in a minute. But this intermittent fasting idea has several potential benefits. Number one, you start kicking in some of those fasting effects, even with a short fast, that, again, cumulatively may be beneficial. It may help with overeating by not letting people eat 3 to 4 hours before they go to sleep. They tend to overeat less at night when they're actually fatigued rather than hungry, and they're eating for stimulation so they can feel better, or they're eating because they're bored, or they're angry, or they're watching the news, or whatever it is that, has them impacted psychologically. The other thing is you sleep better, because by not eating right before you go to sleep, your blood sugar levels tend to stabilize. You don't go into the vacillations that go on when you're actively trying to digest food. So you can get into a deeper non-REM sleep. You can get better quality of sleep. And when people sleep better, they have more energy. They're more willing to exercise and resist some of the challenges that there are in adopting health-promoting diets. So I think intermittent fasting is important. We've done it at True North Health Center since 1984 by limiting, having an early supper, not having habits of eating after dinner, and then not breaking the fast till breakfast, at 8:30 or 9 or whenever it is in the morning. And so we've always used this period of 12 to 16 hours of fasting as a routine habit for everybody.
So that's more of
you should fast every day for 12 to 16 hours.
Is it fair to say it's more of a health promoting concept than a disease reversal concept?
Well, I think that disease reversal by definition is a result of health promotion. So you promote health so the body can heal itself. I don't think that the things we do are so much about preventing treating disease directly as much as promoting the body's natural immune response. And so focusing on healthful living is how you get healthy. It's not from pills and potions and powders and treatments.
So a question that we get all the time is from one of our viewers and listeners here is, what advice do you have for people fasting at home if you can't come to True North? Is there a safe length that you can fast at home, and any guidance you have for people doing that?
Absolutely. And again, we believe everybody should fast at home every day for 12 to 16 hours. And almost everybody can do that safely and effectively. It doesn't require modification of procedures, including medication procedures, et cetera, that people might be doing. It doesn't entail the type of intense biological changes that occur in long-term water fasting. And so I think intermittent fasting is a habit that everybody largely can develop and be successful with. When it comes to longer-term fasting, the very short fast beyond 16 hours have some limitations. For example, when you go 24 or 48 hours or 72 hours, the problem is that's a very biologically expensive part of fasting. That's where your body's making the adaptation to fasting. So you burn some protein, you burn some glycogen stores, but you're not getting the intense detoxification that you get in a longer-term fast. But you do end up using a lot more labile resources. And so I think people are a lot better off doing 16 hours every day, and then occasionally, when it's appropriate, doing a longer fast that might range anywhere from 5 to 40 days, depending on the circumstances. And of course, that's really not going to be done at home. That's going to be done in a controlled setting. If a person is going to fast at home, there is a way to do it. First of all, you'd need the cooperation of your local doctor to make sure a history exam and lab baseline has been established. Whether you're fasting in a facility or you're fasting at home, you still need to have history exam and lab accomplished, because you want to make sure, number one, you're a good candidate for fasting, that there's not a contraindication of fasting. Number two, if you're going to fast, you need to have some way of telling the difference between a positive healing crisis and a problem. They can look very much the same. So unless you have the benefit of some ability to be able to determine that, you take a risk of assuming a healing crisis when actually you're dehydrated, or you're running into electrolyte problems, or having problems that can arise. But conversely, if you panic every time there's a symptom in fasting, you're never going to be able to get through the fasting, because the fasts are oftentimes intense processes. And that's the advantage to working with people that can guide and support you. Now, we do have patients right now that cannot get into the United States, for example, because of COVID and some of the things. They're not allowing people to come in, or they're allowing them to come in, but then they can't go home, or there's all kinds of convoluted problems going on right now. So what we've been doing is, some of our doctors on our telemedicine practice, on our phone coaching service, have been working with local doctors to help patients go through fasting safely. Justin Wise particularly has been doing a lot of that successfully. But the problem is, you still need to have a local doctor that's sympathetic and cooperative. So they'll order the lab, they'll do an exam, and be available to the patient should problems arise. And so in that circumstance, we can sometimes work it out so they're able to do some remote fasting. The other good news is that there's more places now available to do fasting. We've got Gracie Ewan in Ohio. We've got Nathan Gershfeld in Orange County. We've got Frank Sabatino, and occasionally Dr. Esser doing some work in Florida. There's Ralph Sinkay in Texas. There's other people coming along that are working on
Asa and Joanna Frey in Puerto Rico.
Absolutely. And if you go to Health Science, you can look at the magazine, and there's a whole list of people, everybody I've mentioned, plus the people I've forgotten. So there's definitely more opportunities. And given the fact that our internship residency training program at True North is becoming more and more successful, I expect more and more of these doctors to be able to figure out how to get facilities open. There's clearly more demand for these services than what we can provide easily. So I'm optimistic that we'll see more facilities opening, more opportunity for people to do medically supervised fasting safely and effectively.
Dr. Goldhamer, we have a series of questions about a series of conditions and asking whether fasting is appropriate or contraindicated. And the first one is not really a condition, but it's people of low weight. Can people of low body weight fast, or will they turn into a concentration camp victim from whom they will never regain their weight back?
Yes, actually, sometimes the only way we can get to build people back up is to do a short period of fasting and reboot their gut microbiome and get their digestive system working so that they can absorb food. Some people have such disrupted guts that they're difficult absorbing food. And so sometimes, even though it seems indicated to fast a thin person, sometimes thin people doing short fasts can be very helpful to helping them recover. Yes, now we do have some general standards. We do not like fasting people with a BMI below 16. We prefer not to fast people with BMI much below 18. But even thin people can fast, but all the more reason why they should be doing that in a controlled setting under direct supervision.
Couple others that raised about can fasting be helpful or harmful to people with Hashimoto's disease?
Yeah, Hashimoto's is the most common cause. I think they say 90 to 95% of hypothyroidism is Hashimoto's thyroiditis. This is a condition where your body's immune system attacks your thyroid and causes it not to put out enough thyroxine, which is a real serious problem, because when you have very low thyroid, your metabolic rate slows, you feel sluggish. It's not good. People don't like it at all. And so that disease is largely caused by your immune system attacking your thyroid. And what's interesting is that there's a gene associated with that disease. If you have a HLA-DQ gene, you have a higher likelihood of developing that condition. And that's the same gene associated with another condition that's called gluten sensitivity. which is oftentimes associated with celiac disease. About 1% of the population have celiac disease, where if you eat gluten, your body's immune system will attack your intestinal tract. And a very serious condition, can be deadly. And the only real answer is to stop eating gluten. So people have to go on gluten-free diets. Ironically, the very diets that we tend to recommend anyway, but a separate issue. So the theory is that in some people, they have this HLA-DQ gene, which is associated with celiac disease, but the immune system doesn't attack the colon. Instead, it attacks the thyroid. And we call that Hashimoto's thyroiditis. And so there's a theory that this exposure to gluten in those people that are genetically vulnerable stimulate this immune response and may be associated with much of the hypothyroidism that we see. Now, the problem is once you've been on thyroid replacement therapy for a long period of time, 10 years or more, it's very unlikely that you'll get enough of a recovery to completely eliminate the need for thyroid replacement therapy. Ironically enough, thyroid replacement therapy is a true hormone replacement therapy. It's one of the few drugs that we actually can fast people while they continue to take that medication. Most medications you have to stop in order to be able to fast. Fasting can be done on thyroid, although you do often have to reduce the dosing. And interestingly enough, after fasting, sometimes people need less thyroid medication, and you have to be very careful to get the dosing right, because too much thyroid medication not only causes palpitations and all kinds of stress symptoms, but also can be associated with increased risk of osteoporosis. So you never want to be on more thyroid medication than absolutely necessary to replace what's not produced because your thyroid was destroyed, because your immune system attacked it, because perhaps you got exposed to gluten. So I don't remember what the original question was, but the answer is you can do a lot to prevent hypothyroidism. And if you have Hashimoto's thyroiditis, you can use fasting and a diet that's free of dairy and glutinous proteins, and oftentimes get significant improvement. Some people with early phase Hashimoto's can recover and eliminate the need for meds. People with long-term medication use may still require some level of medication, perhaps a lower dose.
So a number of women have asked about fasting and this kind of diet and lifestyle and Hashimoto's disease and these thyroid-related conditions. A number of men have asked about prostate and
yes,
what your experience has been, because that's
a really older. As men age, a lot of times one of the first symptoms of prostate problems, most common condition is benign prostatic hypertrophy, and is urinary frequency at night. As the prostate enlarges, prostate is a gland, and it can put pressure on the urethra and the bladder gets involved. And so what happens is people will begin not completely emptying their bladder, and so they'll wake every couple hours having to urinate. And so if you're waking 2, 3, 4, 5, or 10 times a night to urinate, you can imagine that disrupts sleep quality, and it's very inconvenient and distressing to people. Well, fortunately, this condition of benign prostatic hypertrophy can respond to diet and lifestyle change, and specifically to long-term fasting. And so we have many patients after a long fast will find that instead of waking 2, 3, 4, 5, 10 times a night, they may only make once or twice a night. And that dramatically improves sleep quality and eliminates the distress that's associated with that condition. Now, there's also people have bladder infections, and there's all kinds of other problems that affect the bladder as well. But this benign prostatic hypertrophy is very common, particularly as males age.
So there's hope.
Yes, there is. And it's really common, I think even more common in people that subscribe to whole plant food diets and follow the natural hygiene principles, because unlike their colleagues that die at 56 or 62 or 73 from heart attacks and strokes and cancer, these people on these diets tend to live a long time. I mean, I've got these patients now coming in 30, 35-year follow-ups. They're in their 80s. They're still doing great. But some of them they're getting distressed over it because they're living so long that they're often outliving all their friends. Some of them are outliving their kids that aren't following healthy diets. And so, you have to be particularly concerned about these issues if you're going to follow this kind of diet, because you're likely to live a long, long time. And so you have to be prepared that you'll live long enough to get some of the problems with aging that your other people may never have to face. So my mother, when she was 92 years old, she told me she had realized she outlived all of her friends. She had a list of 52 friends that she had known and over the years, and all of them including the ones that used to make fun of her crazy diet, were dead. And she said that, I needed to warn patients that if they were going to follow this diet, she said, make younger friends. Because when you get older, it's very hard to make friends. You don't have as much social contact. So
did you refer that person to Doug Lisle for counseling? Did you refer that person to Doug Lisle for counseling?
But I'm serious. People should make younger friends or make friends that maybe are health conscious. So at least when you get in your 8th, 9th decades, you'll have people that you can still socially interact with.
So another question that we have a lot of questions on is about your take on supplements, vitamin D, EPA, DHA, B12. Those are the 3 big ones that everybody asks about. I have repeated questions about it. What's your take on how necessary are they as an adjunct to a health promoting diet?
So I don't like pills. I don't like treatments of this nature in general. And I think that fortunately, on a health promoting diet where you're getting whole plant food diet, fresh fruits and vegetables, grains, legumes, nuts, and seeds, and avoiding the meat, fish, fowl, eggs, dairy products, oil, salt, and sugar, the vast majority of nutrients you need, both quantity and quality, are abundantly provided by the diet. There are a couple of problem nutrients that we have to discuss. Number one is vitamin B12. Now, in a natural setting, you would not have a problem with B12 because you would be eating food off the ground, off the trees. There'd be insect fecal contamination. You'd get lots of bacterial contamination, and you'd get plenty of B12 because that's where B12 comes from, is bacteria. The problem is, if you do that, you tend to get worms and parasites and illnesses. And so we learned a long time ago that if you practice good hygiene, that is, you washed and you peeled stuff and you didn't eat feces and dirt, you could avoid getting a lot of these poisons and illnesses. The problem with our hyperhygienic environment today is we get very little bacterial contamination because we're washing, we're peeling, and as a consequence, over enough years or decades, you could eventually not get enough bacterial contamination to get enough vitamin B12 and could develop B12 deficiency. That's a very real problem. It may take, in some cases, many, many years to get there, but eventually you can, and it does show up in long-term vegans that don't supplement B12. Now, meat eaters get a lot of bacterial contamination. Part of it's from the feces in the dead, decaying flesh that they eat. For example, if you take a pile of ground beef and you separate it into beef cells and fecal cells, feces, you'll have a pile of feces with every pile of meat because fecal contamination is a very common part of meat raising. So if you're eating meat, you're likely getting a lot of bacteria, a lot of exposure to B12. You may not be quite as vulnerable as a person that's washing and peeling and being careful and not eating all that bacterial contaminated food. As a consequence, if you're a vegan, we recommend 1,000 micrograms of methylcobalamin a day. Now that's amount of B12 that would fit on the head of a pin. It's a very small amount that's needed, and it's very easy to do that. You can use a liquid B12, a vegan capsule. There's lots of different forms and brands and all kinds of stuff out there. And people that take 1,000 micrograms of B12 a day or a single capsule of B12 do not tend to get vitamin B12 issues. In fact, I've not seen anybody so far in 39 years of practice that's supplementing B12 that develops B12 problems as a consequence of deficiency. So I think that's an easily solved problem, and it's the one nutrient that we do recommend routinely supplementing. There's another nutrient that's occasionally a problem only because of people's habits, and that's vitamin D. If you don't get enough sun exposure, which is the way we form vitamin D naturally in our skin, you could develop vitamin D deficiency. And it's actually so common now because, number one, people moved away from the tropics and we live in areas where you can't make vitamin D half the year. Like where I live in Northern California, half of the year the sun's not hot enough to actually form vitamin D. So you either get enough exposure in the summer where you store up vitamin D, or you have to supplement vitamin D. It doesn't take much. 1,000 or 2,000 units of vitamin D a day is enough to maintain normal levels in most all people. There are occasionally people that have particular difficulties with absorbing D that might need a little bit higher dosage, but it's easily determined with a simple test. We test for 25-dehydroxyvitamin D. We test all of our patients once a year for 25-dehydroxyvitamin D, and we can tell from what level comes back if they're getting enough, or if not, what the dosing has to be to supplement. Now, unlike vitamin B12, where it's a water-soluble nutrient, you're not going to get too much, you just pee it out, basically. Vitamin D is fat soluble. You do not want any more vitamin D on board than is needed. So you want enough to maintain normal levels, but you don't want extra and just taking large quantities because it can accumulate and actually cause problems, like many supplements. Many supplements can cause problems when they're taken in higher dosages than appropriate. In fact, many of my patients get well just because we stop them taking the $1,200 a month worth of pills and potions that somebody sold them, convincing them that their problem was a problem of deficiency, when in actuality, their problem was more likely a condition of excess or sleep deprivation or some other issue.
So a related question to that before moving on to the DHA question or the algae question is, would you support using a specialized UV lamp at home, like the Spurty vitamin D lamp, for someone in the north who prefers to avoid supplements?
Yes, you can use a vitamin D lamp, sun lamps, or I think the best way is to get out in the sun gardening, during the time of year when the sun is hot enough in order to form enough vitamin D. And in most areas, you can store enough vitamin D in the summer to carry you through, much of the winter and reduce the need for supplementation or a sun lamp. Sun lamps might be a more natural way of forming, D on your skin, and that's certainly an option for people. And again, the blood test is quite reliable, and so you can use the blood test to determine if your approach, whatever approach you're taking, is meeting your needs.
Is there a generally considered normal blood level B12 vitamin D that you should be looking for?
Well, we know that if you have less than 20 units, it's considered deficient, and that's probably true. Normal levels, you'll have people talk anywhere from 20 to 70 units. We tend to look at, when we find people that are healthy, that get a lot of exposure outside, they typically run between 30 and 50 units. We think that's probably pretty good. I don't worry if it's under 70. I would be a little concerned if people are getting beyond that. I would reduce supplementation back unless there was some very specific clinical justification for running higher levels. There is some data on patients with MS and others that higher levels may have some clinical benefit, but that's a very specific individual thing.
Speaking of a health promoting diet, one listener writes in, or one viewer writes in, there seems to be conflicting info between the plant-based doctors regarding nuts and seed consumption for people with cardiovascular disease. Any distinction between people with that or without that and the consumption of nuts and seeds?
Well, the problem is there's a limited amount of research, and the research that's done that shows the reversal of coronary artery disease happened to be, work done by Dean Ornish. And he used a 10% of calories from fat diet. He didn't really experiment with whether you included nuts or didn't include nuts, or 15, 18, whatever. In our own practice, we include nuts and seeds in the diet of most of our patients, including those with cardiovascular disease. And in fact, the diets that we advocate include up to an ounce a day of things like walnuts or flax seeds or other things. And that means the diet's going to have somewhere between 15 and 18% of calories of fat. So it's not an ultra low fat diet as might be suggested by Dr. Ornish's data. We don't have published data yet to prove that a 15 to 18% of calorie diet with some nuts and seeds works just as well as a ultra low 10% of calories from fat diet. However, that has been our clinical observation. And so it's our belief that the diet that we're using does in fact reverse coronary artery disease and has potential advantages because of the high nutritional density benefit of fruit, of nuts and seeds in the diet. There are sometimes people where they exclude nuts and seeds entirely may develop some symptoms. Now, it is possible to correct those symptoms even if you can't eat nuts and seeds. For example, some people have food sensitivity issues or problems where if they eat a little bit, they've got to eat a lot. So it's hard for them to regulate quantity intake. And so they may find they're better off not eating any of those foods that they tend to binge on. Those individuals may benefit from supplementing DHA, which is docosahexaoxalic acid, which is the end product that are formed from the omega-3 fatty acids you get from the nuts and seeds. And so if they're developing dry skin or they do a blood test and they have low DHA levels, they could supplement an algae-based DHA to make sure that they were getting enough. In my experience, most patients that are including nuts and seeds and lots of green vegetables in the diet get and form enough DHA in order to meet their clinical needs. So we don't recommend that as routine supplementation. But certainly if people have clinical justification, that may be a consideration.
So someone else asked, speaking of the diet, Someone asked, what are your thoughts on a 100% raw vegan diet, a raw food diet?
Well, there's some challenges to a 100% raw vegan diet. If you're just eating fruits and vegetables, fruits have 300 calories a pound. Vegetables have 100 calories a pound. If you're just eating raw vegetables, you need 20 pounds of food a day. It's hard, even if you start at midnight and don't stop eating all morning and all night and all. It's just you can't get 20 pounds of food taken in and digested. So if you add fruit, which has 300 calories a pound, you can do it. You can get enough calories, but the problem is you end up with a very high sugar, low fiber type diet unless you're eating lots of fruit and lots of vegetables. Some people do that successfully. That's fine. It's a bit of a challenge though, because it does take a large volume of food, which means you're spending a lot of your time eating. And unless you get enough vegetables in, it can create problems over the long run. We see people on very high sugar diets, they eat a lot of fruit, not enough vegetables, then they get mineral depletion, teeth, nail, hair, gum problems, they get emotional volatility, immunological vulnerability. And of course, I get a lot of patients that are sick because they're on fruitarian type diets, which we don't recommend. So the people that I see that are on raw food diets that are thriving usually include large amounts of vegetable materials in their diet. Now, the problem is to get enough in, they're usually juicing or processing foods. And I'm not sure that there's any justification or argument that juicing vegetables is more natural than steaming vegetables. We've used heat to process our food a lot longer than we've had juices around, believe me. So from a natural standpoint, I think eating heat processed vegetable materials, including starchy vegetables, is in fact what humans evolved on. If you read interesting books like Catching Fire, there's an argument that's made that that's how we became humans, is that we used heat to process vegetable materials, increasing our caloric density enough to supply our biggest burner of glucose, which is the brain. And so, the human brain is used 2.5 times as much glucose as, say, a chimpanzee or something. And it is also one of the reasons why fasting was so critical to survival for humans. When you think about fasting, it really just means the ability of the brain to change fuels from burning glucose to burning fat. Were it not for our ability to change fuels, we never could have left the tropics. You'll never see chimpanzees leaving the tropics because they can't fast. Their brain keeps burning glucose. And after a week or so, they're going to be in big trouble. Humans, even a thin male, 70-kilogram male, can fast up to 70 days because the brain itself changes fuels to burning fat. And so we can live on fat stores and go for months compared to days or weeks. And that's how humans that were able to wander away from the tropics survived when spring came late.
So that kind of brings up a question that someone else asked about, what's the difference between fasting and starvation? When the starvation begins, how do you know when are you in that danger zone?
Mm-hmm. Fasting is when you have labile reserves. You fast, and as I said, the average person can go for many weeks, and then eventually you would deplete your reserves, and then you would enter a process called starvation. And that's where you break down vital organ tissue and then you die. So we don't have any experience with starvation because we don't do that. Part of monitoring people fasting effectively is making sure that they have adequate reserves so that we don't enter that starvation process. And I'm happy to say that of the 21,000 people that have gone through fasting at the True North Health Center, everybody that's walked in to do fasting has been able to walk out. And so we've been able to avoid starvation, and we want to do that very diligently because starvation results in death, and that really messes up our outcome data.
They do call you the last resort.
They do. True North Health Center, the last resort.
A couple other conditions. Again, a number of people have asked about specific conditions, and I don't want to go into the specific things they say, but three conditions where they're asking whether they respond well to fasting in your experience. Breast cancer, people with hypoglycemia, and type 2 diabetes are three that just identify.
Well, type 2 diabetes and hypoglycemia have a lot more in common than you might imagine. Type 2 diabetics. Diabetics are people that make enough insulin, but it doesn't work because of insulin resistance. And so what ends up happening is in a type 2 diabetic, they have enough insulin, but it just is not working. And it's the thing that causes insulin resistance is the diet that makes people fat. It's not just the obesity. Because remember, even an obese patient, as soon as they change the diet, their blood sugars start coming under better control. They don't have to lose all their fat to normalize from diabetes. They have to change their diet. As soon as they change their diet, the fat starts coming off. It comes off in a very predictable way. If you're a male, it comes off at about 3 pounds a week. If you're a female, about 2 pounds a week. So women lose about 50% less fat than men, everything else being equal, because they're rich in estrogen, which is a fat storage hormone. Men are rich in testosterone, which is a fat burning hormone. So it's a little bit easier to get men to lose weight than women, because women are essentially, if you think about it, they're energy conserving fat storage devices, biologically speaking, because women have to survive a period of vulnerability called pregnancy. And it's women that have the babies, not men, thank goodness. I actually did the math on this, Mark. You know, if men had the babies, our species would have been extinct in exactly 20 generations. And the reason is because it turns out that you have to have 2.1 babies per couple in order for a species to survive. And I can guarantee you, if men had the babies, there never, ever would have been a second birth. And as a consequence, after 20 generations, our species would have been extinct from the planet. Fortunately, women have the babies, and women are willing to do that. And as a consequence, you know, we continue to thrive and survive.
So have you fasted people with breast cancer, and have they responded well?
So we do treat patients with all forms of breast cancer, early phases and more advanced phases. And I think that breast cancer, like many other conditions, there is no what I would consider a cure for breast cancer any more than there's a cure, for example, for obesity. You can lose the weight and you may maintain a normal weight the rest of your life. But as soon as you go back to eating greasy, fatty, processed, dead, decaying flesh and highly refined carbohydrates, you're going to gain your weight again. So you haven't cured obesity, you've just managed it with a healthy diet. And you don't cure breast cancer or any other cancer. What you do is you manage it. You try to get the body's immune system healthy enough that it can keep things in check. If you go back to the things that caused it to begin with, it's likely to recur.
You know,
so I don't like this whole concept of cure because I don't think it's real.
One of your colleagues, Dr. Frank Sabatino, I remember him saying one time that the whole approach of natural hygiene and the fasting and the health promoting care you do is that the body has a lot more capability to recover and regenerate itself than we give it credit for. And he's always suggesting that you always try that first before conventional treatments, because the body has a lot more capacity than we often give it credit for. Has that been your experience as well?
I think Dr. Sabatino knows what he's talking about. The fact is that the body is, and sometimes shockingly, more effective at healing itself than we ever really dream of. And you know, I can tell you, when I was getting a chance to be in Australia and I was studying with Dr. Burton, I kept saying to myself, I must have said it 50 times, if this one gets well, I'll really be convinced. Because I kept seeing these people overcoming conditions that I knew from my training were not going to overcome. And many of them are common conditions. For example, high blood pressure. If you have high blood pressure and you go to a conventional physician, they will tell you that you will need to be on drugs for the rest of your life and that you'll never get well, that you will be sick forever, and that you will die, whether it's from the high blood pressure or from the drugs that they're using to treat it. There's nothing that can be done. They don't know the cause of essential hypertension, so there's nothing to be done to fix it. You just have to take these drugs, the beta blockers, the calcium channel antagonists, the diuretics. They cause chronic cough, fatigue, impotence, and actually death itself, which is why they can't give you the drugs until your blood pressure rises to a certain level, because the death rate from the drugs exceeds the benefit from the medications. And now our experience is very different. Patients with high blood pressure, they normalize their blood pressure, and we can usually predict about how long that'll take. And if they're willing to do dangerous and radical things like eat well and exercise and go to bed on time, they can maintain that normal pressure. And we've been able to show that now in some patients for decades, that they've been able to normalize their blood pressure, maintain normal blood pressure, and then they don't get the consequences of the hypertension that everybody else they know is suffering from.
Dr. Goldhamer, a couple of practical questions that people ask about staying at True North. One of them is, does Medicare pay for fasting at True North, or will my health insurance cover my care at True North?
Well, Medicare and health insurance will pay for your medical exam, medical monitoring, and lab, but it will never pay for fasting supervision. Fasting supervision is about getting well. No health insurance has anything to do to be paying for getting well. So they would not cover the daily rate, but they would cover the medical management charges and testing and any of that type of stuff. It would pay just like it would be seeing any physician.
And what does it cost to stay at True North?
The least expensive way to stay at True North is in a private room with a shower bath. It's $169. The most expensive way to stay would be a private room, private bath, which could be as much as $219. It depends on what kind of accommodations you pick. So the fee is based on however many nights people stay. They can, it doesn't matter how long they book, it's just however long they stay. So if a person books longer but ends up being done quicker, there's no fee or penalty because they get done faster.
So
the
another
only challenge is that we have a big problem right now is that we are booking considerably in advance. And so people do have to plan ahead a bit to get a bed at True North Health. Fortunately, as more facilities are opening, we can provide people with the names and the numbers for other people that might be able to meet their needs without necessarily having to wait as long as it takes to get into True North Health.
So one of our listeners asks that they read recently that you've opened up a health coaching program at True North.
Yes.
People that can't come to True North. Can you explain how the health coaching?
Yeah, we're really excited about this, Mark. The health coaching service is really simple. They go on to our website just like they normally would, fill out the registration forms. We offer a free consultation with me. And what I do is I'll go through their medical history, determine if they're a candidate for this type of an approach, and then try to help them find somebody that's appropriate for their condition and their location. And so we'll try to match them with somebody that's appropriate. We have, I think, 14 attendings now that are on our website, and we've added some new people like Dr. Frank Sabatino, Dr. Justin Wise, that are not necessarily attendings at True North Health, but they're experienced doctors that we know, that we've either trained or we're able to vet, and they're all available affordably. And patients can go on, look at their own schedule, pick the doctor they want. They can read all about the doctors. They can pick the time they want. It's all done online. It's very efficient. And all of the doctors have full access to all of their records through the True North Health portal. So all of their records are laboratory. Everything that's sent into us that we review is available to any one of those doctors.
And so, what's the cost? What's the cost?
$40 per 20 minutes. So if you have usually with a new patient visit, they encourage a 40-minute visit. For return visits, it easily can be done in 20 minutes. And so for whether it's $190 or for $95, they're able to talk with a doctor that's not an idiot. They can give them good advice. Now, they obviously are not going to be writing prescriptions for their marijuana or their Viagra or their whatever it is. They're not writing prescriptions. They're not making diagnosis over the internet or the phone, whichever they're opting for. But they can help them know what questions to ask their own physicians. They can help them figure out what studies or help them interpret the results of data that's been done. They can give them advice. They can give them coaching. They can give them encouragement. And they can kick them in the butt if necessary in terms of motivating them to make these changes that they're going to need to get well. A lot of times people just need encouragement or understanding of what their symptoms are and what they might mean.
So if somebody has a fever of 101, they can call for a health coach and talk
Absolutely.
to
They can advise them on what they should do or what questions they should ask their local doctor, what testing might be appropriate, how to interpret the testing that results. And so, the nice thing with Zoom is we can actually even look at people and get a pretty good idea there. You can't do everything over the internet, but there's an awful lot that experienced doctors can do when they're looking and talking to people. And it's particularly useful for our returning patients. Many of our patients come from all parts of the world, and they can't always get on a plane to fly in to get a visit, but they can go online and do a Zoom or a phone consultation. And we can provide the kind of ongoing support that oftentimes people need.
And I imagine that once somebody does develop, if they're a patient at True North and they develop a relationship with one of your staff physicians, they've been their primary care, they can do follow-up with that physician.
Well, we do absolutely encourage that. A lot of our follow-up now is being done through this tele-coaching business. And the best news, the best part of it that I like, is not only does it make affordable care amenable, but all of the proceeds from that operation, as are the proceeds from the True North Health Center, go to the True North Health Foundation, which funds our research. And so when people are participating in these programs, they're also funding the research, which is allowing us to do a better job.
Got it. Well, we're getting up near the top of the hour here, so I want to do a kind of a lightning round of some questions here to get as many questions answered as I can. The 1 meal a day people, it's kind of an intermittent fasting by the other name. Are you a fan of 1 meal a day?
If that one meal is whole plant foods, that's fine. The problem is you can only get about 500 to 700 calories of healthy foods in the stomach. When you eat a lot of fruit and salad, it takes a lot of space. And so if you're only needing 500 to 700 calories a day, that's fine. And as long as you have extra reserves, that may work well. But eventually you're going to deplete those reserves, and you're going to need to go to a 2 or a 3 meal program in order to get enough volume in that 8-hour window.
So as a variation on the 1 meal a day program, there is the fasting mimicking diet, Prolon, taking a kind of a powdered supplement as a daily regimen. What are your thoughts about that?
Well, I love Walter Longo, who's who's pioneered this intermittent fasting. And what he did is he took like macadamia nut power and some supplements, put it into a monetized product that people eat nothing but these packages 5 days a month. Now, they don't recommend eating healthy diets the rest of the time. They but just not eating greasy crap 5 days a month is enough to begin inducing some changes in some patients. Now, I think that the theory is that you can get all the nutrients you need and do a modified version of fasting safely for people at home. And I agree with him that you can't do long-term water-only fasting at home. You certainly can do Prolon. And we're interested in doing some studies with Dr. Longo comparing, fasting and intermittent fasting. That it'll be interesting to see, where its application is best suited. I was a little bit concerned when I was reading Walter Longo's book because he said, don't ever do long-term water fasting because it's too dangerous. But then he said, unless you do it at the True North Health Center. So I evaluate other doctors' intelligence based on how much they agree with me. So I consider Walter Longo a genius.
Good. So resting during fasting. One of the viewers asks, how important is it to rest during?
Yeah, it's really important because if you don't rest when you're fasting, what happens is you burn glucose. The only place you can get that glucose after a couple of days and you've used up your glycogen stores is protein through a process called gluconeogenesis. So people say, well, they exercise when they're fasting, they lose more weight. They do, but the weight they're losing is in fact protein, not fat. We've published a study recently that people can view on our website at fasting.org that looks at the body composition changes that occur in fasting. And what we found is that water-only fasting preferentially mobilizes the type of fat that's most health compromising, which is visceral fat. You'll lose a disproportionate amount of visceral fat in water fasting, and you'll certainly lose adipose tissue. You also lose protein, water, fiber, and glycogen. But when you come off the fast, what this study showed is that you regain your water, glycogen, fiber, and protein, but your fat loss continues. And your visceral fat loss continues preferentially. So in the end, what you've done is you've traded a bunch of visceral fat and adipose tissue, and you regain your water, fiber, glycogen, and protein. If you exercise, you will lose more weight during the fast, but it'll be made up of more protein, not fat.
Well, isn't the history of fasting, the historic definition of fasting is a physiological rest?
Yes.
So you're resting on all cylinders to allow your body to maximize its healing powers.
I don't know about all cylinders because, as restful as fasting can be, it can also be a very intense physiological process because some things get activated and you can get some very entertaining healing crises that show up. So I think the body has an inherent wisdom and it knows what to turn up and what to turn down. And our job is to try not to let our arrogance exceed our ignorance.
I got an interesting question from someone. Is it safe to eat sea vegetables in light of the Fukushima disaster? And it brings to mind, the question that they've said that even people that consume fish is so contaminated these days that you should avoid even the wild caught salmon and all that. Does the same extend? Do you have that same concern for sea vegetables, or is there any value in it?
I would be interested in buying algae, which I'm sure is growing very robustly around the waste discharge from the Fukushima nuclear power plant. If you are going to use sea vegetables, you'd use them in controlled quantities, and you try to purchase those that are grown organically, preferably as far away from known nuclear waste contamination as possible.
This is an interesting question. Someone says it is necessary to take a collagen supplement. I keep hearing how important it is to have a youthful appearance for healthy joints since our bodies start depleting it around age 25. And I suppose that lends itself into the Botox question too. Is there any value in doing that? Is it more to look good than to feel good?
I don't think so. In fact, collagen that you eat isn't broken down and magically transported into your tissues. It's a great theory, but I don't think there's much support for it. And the bone broth people are creating all kinds of problems with lead contamination, all kinds of other problems. It's just, there's so much nonsense out there. I think people just have to use common sense and realize that, if it sounds ridiculous, it probably is.
So the last question I have, and then I'll look to a couple that may have just come in, is annual fasting. I seem to remember that you and Jennifer and other people on your staff over Thanksgiving, historically, that's when you fast. Is there some value to fasting annually? Is this a benefit to rebooting your computer by fasting 3, 4, 5 days just as a health promoting practice?
Yeah, our clinical observation is that it most definitely is. My personal experience is that it most definitely does, but we can't prove it yet. We are doing a study, though, that's looking at using biological markers to see whether healthy people fasting really do get the benefits that it seems like they do. I personally believe that we're going to realize that the people that get the most benefit from fasting are actually healthy people using fasting preventatively in order to stay that way. I think fasting is going to prove to be one of the most powerful tools we have at helping keep healthy people healthy. But that can't be proven yet because there really hasn't been a study looking at that. And that is something that's on our agenda to begin doing. So hopefully we'll have data next time we talk that will either support or refute that idea. But I do practice that, as do most of our staff, where they'll fast for a week, once a year. And if at the end of that time they're stable, we call it the day. If they have symptoms, we'll continue until those symptoms are clear.
But do you think it really can, kind of like they say, you shut off, restart your computer, that there is some rebooting of your systems that can take place?
I don't have any doubt that that's true. I see it, every day here at True North Health. We see that process going on. In animal studies, you can take rats periodically, fast them, and double their lifespan. And although we can't prove that in humans yet, I think it's likely that many of those same biological mechanisms are taking place.
Dr. Goldhamer, we have a ton more questions. You are our inaugural guest for our Power Your Health Q&A. I hope you'll come back on another occasion. I'm sure we'll have a lot more questions from our viewers. You're a wealth of information and a treasure for the NHA.
And, if people have an urgent question that didn't get answered, they can email me at truenorthhealth.com. I'll be happy to do my best to answer any questions we didn't get to today.
Very good. Well, I really appreciate it, Dr. Goldhamer. Again, you're a treasure of information for us and a treasure for the NHA, and we're really honored to have you as the premier guest on our Power Your Health Q&A.
Thank you, Mark.
You bet. So just a few words from our sponsor, if I can. We publish, the National Health Association's been around since 1948. We're the oldest organization on the planet advocating the benefits of a 100% whole plant food diet. We publish one of the best magazines on the planet called Health Science Magazine that comes out quarterly. It's a 40-page magazine that has no advertising in it, just interviews and articles by the likes of Dr. Alan Goldhamer and Frank Sabatino and Michael Greger and more, and recipes by people like Chef AJ and Kathy Fisher and all the champions of the SOS free diet. Health Science is 40 pages long, contains no advertising. It's only $35 a year. It's included with your membership in the NHA. If you're from outside the country, it's only $55. And if you join by the end of this month, you will be on the mail list for the fall issue of Health Science Magazine that has a marvelous interview with Dr. Lori Marbus, who started Plant-Based Telehealth. It has recipes by Tiffany Wilkerson, great articles on our environment by Glenn Merzer and Dr. Ron Weiss, and a whole lot of Dr. Will Bolsowitz has a great article on gut health. So again, if you get your membership in, you go to healthscience.org and register, you'll be on the list for that magazine, an actual magazine that you'll get in your hands. In addition, if you were not able to attend the 2021 NHA conference, at healthscience.org, you can also sign up for all of the replays, lectures by Dr. Goldhamer and all the rest for only $67. You can do that. And last but not least, you can register for our 2022 NHA conference, which will be June 24th to 26th in Cleveland. It is a life-changing event. I know you'll love it, and I hope you'll consider that. You can do all of that at healthscience.org. All right, I, again, appreciate all of you who have tuned in tonight for this first Power Your Health. I'll turn it back to Michelle, I think, who can tell you about future programs that we have and when you can see them. Michelle, are you still with us? There you are.
I'm here. I didn't know you were pulling me back up, but yeah, so thank you so much for coming. This was amazing. We had so many people joining in throughout the event, and it was really exciting to see your comments. Everyone was saying thank you so much for coming and sharing. And there was a few questions that popped in. I'm sure Dr. Goldhamer's inbox is going to be stuffed here from our conversation. So we're going to have some amazing speakers. October speakers still to be announced, but we'll be back here fourth Tuesday at 4 p.m. Pacific time on the fourth Tuesday in October. I think it's the 26th. And I popped the link in here. I'll pop it in there again if you want to sign up for email reminders for the Power Your Health series. You'll get the email reminders and some extra bonus material from the speakers who come on. And then we'll also send you the link to the replay, just to the YouTube video that we did as well, so that you won't miss it, even if you can't make it. So
And
I'll
they
pop
are
that link
absolutely
below.
free, right, Michelle? They're absolutely free.
Absolutely free. Share with all your friends. It's not just the NHA folks that we're including here, and we would just really appreciate all your feedback and want to know how we can serve you better. So I think that's it.
Thank you,
Thanks so
Michelle,
much
for all your help.
Yeah, and we'll see you next time.
Good night.